Part 3 of the antipsychotic lecture. I'm Dr. Barness. We are going to go over neuroleptic malignant syndrome to end it off, NMS. Let's jump right into it. So NMS is the last EPS that I'll talk about. Okay, it stands for neuroleptic malignant syndrome. As a reviewer, remember this is a problem with dopamine 2 blockade. When you block D2 receptors, you get movement problems, acute dystonia, akathisia, tardive dyskinesia, Parkinsonism, and this is the last one and the worst one, neuroleptic malignant syndrome. I have a mnemonic to remember this. Actually, let's use this space. My mnemonic is fever. So, fever, okay? F is for fever. Generally, most medical professionals will agree that fever is greater than 100.3 or 100.4 and above in Fahrenheit. Notice there's two E's in fever. The first E is for elevated enzymes. Now, there's a lot of non-specific abnormalities, lab abnormalities. You get like a leukocytosis, you can get a transaminitis, but that's not specific enough. So what I like to remember that CPK or CK is elevated. So you get an increase in creatine kinase or creatine phosphokinase, which is a byproduct of muscle breakdown. V is for vital signs are unstable. Okay? Basically, everything goes up, except for maybe oxygen. So everything goes up, blood pressure, okay, pulse, heart rate, okay, respirations go up. Second E in fever is for encephalopathy. Encephalopathy. And this is just a general term that means confusion or altered mental status. So this is basically altered mental status, confusion. The patient will not be oriented, etc. The R is very important for rigidity. And a very specific type of rigidity called lead pipe. Try not to memorize buzzwords here. So remember, cogwheel with Parkinsonism is a rigidity that's in sections. Lead pipe is completely not moving, almost as if you were holding a lead pipe and you tried to bend it and you were not able to. It's kind of like the same idea. So if this happens, what we want people to know, what we want the med students or physician assistant students to understand, nurse practitioner students understand, is that if you're in an emergency room setting, okay, you're in an emergency room setting and somebody comes in with possible NMS. Let's say they had too many antipsychotics and they have confusion and they're tachycardic and they're febrile and they're confused and they're rigid. What is the next step in management? And what you need to understand is that the next step in management is IV fluids, because the most important part of this is the fever, believe it or not. So you may think, oh, but we have to get, the other vitals taken care of. But really the fever is the most important, imminent step to take care of. And the quickest way to lower somebody's fever in an ER setting is good old-fashioned IV fluids. If you have cold fluids, great. But regular fluids should do the trick. Once that happens, this is a patient, if CPK is elevated, you're probably going to transfer to the ICU at this point, at least to a telemetry floor, but this is really a medical admission, and you're going to admit them once the IV fluids are in. Now, what you need to understand is once the patient is on the medical floors and let's say the fever is taken care of, you need to understand what's dangerous later. And what's dangerous later, I'm gonna erase some stuff just to make it a little bit easier. But what's dangerous later is this rigidity. Get rid of some stuff. Okay, this rigidity causes rhabdomyolysis. Rhabdomyolysis. Now, when you're so stiff that you get rhabdo and your muscles start breaking apart, the intramuscular protein in muscle cells is myoglobin. And when a muscle cell breaks open, myoglobin leaks out. And you get myoglobinuria. followed by potentially an acute kidney failure, and worse, maybe. The only good news in this whole story is that the treatment for rhabdo, if you guys recall, is IV fluids. So the quicker you get these IV fluids in, the better it is. There's going to be a trick on the test that if they ask you the medication of choice, this will be the answer. But if they ask the next step, it's IV fluids. But there is a medication that's used here. It's a medicine that works on the ryanide receptors, and it's called dantrolene. Again, this is usually given later because you have to take care of the fever first. You could also use other dopamine agonists like bromocriptine and similar things. Again, if you guys made it this far, I'm really proud of you.